I'm from a small town, Mount Sterling, Kentucky, and so this Frankfort suits my needs for that purpose from the standpoint of a small town, small community, the family atmosphere, getting to know people a little bit more on a personal basis. Finished my training and residency at University of Kentucky in 1993. Then went to Western Kentucky to practice for a few years before we came back here in Central Kentucky. And we've been in this area probably now for almost 20 years now. I like for the patient to be involved in her care, which means involved in her decisions as well. It's involved with her taking care of her medical problems, and certainly in the exciting times of having babies. So I think it's important to get as much as the patient involved as well as the family members involved. And I think we do a good job of that here, treating the patient more just not for their medical problems, but also the whole family. Well, I think just by nature of being a little bit of a smaller hospital, I think we can be a little more attentive to the details of a little bit more TLC that the patients can receive without sacrificing quality of care. I think there's several things that probably the general public aren't aware of, whether it be our water labor tub that we have for the women that want to experience labor in a bath or in a tub setting. We've got an NICU that I would put up against just about anybody's that's not a tertiary care facility, because it's staffed by neonatologists that come from Louisville, Kentucky 24/7, and I think that's probably one of our best kept secrets here in Frankfort. I think they do a fabulous job, and it's interesting you ask me that, because I can speak to that being a physician, and I can speak to you that as being a father. I've delivered 3 of my children here, and so I've been on that end of sleeping on the couch or sleeping on the pull-out bed, and know what I've interacted with those nurses at 2 o'clock in the morning or 2 o'clock in the afternoon as a father. And to be honest with you, I was very impressed with their knowledge and their professionalism at that time. I think it's been fabulous. You know, I think it's small hospitals in general fight the attitude or the reputation of being subpar or B or C kind of a hospital, and they got to go to a larger community. I've worked in all the hospitals in Lexington. I've worked in this hospital and many other hospitals, and I would say that this offers the same level of care for our needs and our patients that you would get anywhere else. And over the years, I hope that reputation has continued to improve in a positive manner, that they not only don't sacrifice anything from the standpoint of quality of care, but they also get a little bit more of that TLC that I think all of us would like to have.